I'm Dr. Goeff Fernie. I'm Institute Director for Research at Toronto Rehabilitation Institute. I'm also Professor in the Department of Surgery at the University of Toronto and in Biomedical Engineering. This device here is much more important than it looks. I used to work in the community with long-term care facilities sometimes, and we always dreaded sending one of our residents into an acute care hospital. We had to, because they'd have a hip fracture or something had gone wrong with them, but they'd always come back worse than when they went in. That's the honest truth. Hospitals are very dangerous places. And the biggest danger of all in any hospital is being left in bed. When patients are left in bed, they develop bed sores sometimes, they develop contractures, they develop incontinence because they get out of the habit of being able to go to the washroom, they give up. They develop intestinal problems, they're no longer able to digest things properly. They're not able to get up and move around later, they lose their balance. They become depressed as well. And the big thing is, this big safety issue, the answer is pretty obvious actually. The answer is to have something to help them get out of bed, and then of course not just to rely on that, but to use staff to encourage them to use it to get out of bed. When you're in a hospital, there's nothing to get hold of that's safe, that isn't going to be moving around. They're all trolleys or bed rails that wobble or something. This is firm, you can take a firm grasp to it, and you can pull yourself up and you can transfer onto a wheelchair or just get up and get your balance and walk away. Well, it's called Stand Easy because it makes it much easier to stand up. And depending on whether, for example, you have a right or a left stroke or which side of your body is affected, obviously there's a preferred side to get out of bed. So one of the key things to this product is it attaches to two rails on the wall. You don't have to have the product there. If the person truly isn't going to be getting out of bed or truly can get out of bed without the need for it, keep it out of the way so you can have all your medical equipment around, your respirator and everything else. But if you've got a person who has an opportunity to get out with encouragement, with training, then put it on one or both sides, and it'll make all the difference.